Hi, this is Elliot Fishman, and welcome to the June CT is Us quiz. We have 10 terrific cases for you. So with that, let's get started. Now, in this first case, I'm asking you what the least likely diagnosis is. Incidental adrenal mass. When you look at the non-contrast, there's calcification, and I could be certain there is some fat present. But then you look with enhancement, there's some vascularity, and yes, there's hemangioma sitting within the spleen, within the liver rather. But what is it? Well, okay, myelolipoma is my first guess. Primary adrenal carcinoma? I guess it could be only based on size, but I don't think so. An adrenal adenoma? Gosh, this is big, and I don't know, some enhancement? I would say no. Pheochromocytoma? Sometimes we have big pheos that are not vascular. So I would say the least likely diagnosis was an adenoma. This patient had surgery. This was an adrenal adenoma. Again, I just want to make the point that sometimes adrenal adenomas are large and they don't look like adrenal adenomas, so you're just not going to be right. The most likely diagnosis in this case, beautiful case. What you see are coronary artery aneurysms, right coronary and left coronary artery. What gives you multiple coronary artery aneurysms? Well, if I told you the patient was a teenager, very simple, it's Kawasaki's disease. Multiple aneurysms, and you can see that in a 1 or 2 year old as well. But again, and these can easily balloon out and they can rupture. So these patients, as in this patient, will have surgical resection. The most likely diagnosis in this case, I see a mass in the fourth portion of duodenum. It's slightly vascular. I could think about lymphoma, though usually they're not vascular. Small bowel adenocarcinoma, mass-like I can think about, but usually it's not vascular. Crohn's, this surely isn't. Then I noticed the left kidney is missing. This was metastatic renal cell carcinoma to the small bowel. Just a beautiful example and something we often don't think about. This patient had shoulder pain, and what do you see? You see abnormalities in the bone, particularly in the humerus, though the scapula is also abnormal. In the humerus, there's this sclerotic type appearance. That's the classic appearance of bone infarcts. It's not prostate, and it's not osteomyelitis, and it's not Paget's. Paget's expands the bone. Prostate, the lesions are very sclerotic. And osteomyelitis, there's more destruction of the surface and soft tissue mass. A beautiful case of sickle cell disease with multiple bone infarctions. This 28-year-old female had pelvic pain. Well, what do you see? Complex cystic masses, which maybe are ovarian. I've seen patients who've had simulation for in vitro with an appearance like this. That wasn't the case here. In theory, despite the age, I couldn't exclude ovarian cancer. This is not a missed appendicitis, and it's not dilated bowel. This was endometriosis. Endometriosis is a difficult diagnosis, many different appearances, and this is one of them. This patient presented with a GI bleed. What's the cause? You see this bulky mass involving the fourth portion of the duodenum to the jejunum. There's actually active extravasation present. Crohn's disease can cause bleeding. It's not a great location. And there you see edematous changes in the wall of the bowel. There's this narrowing. You get the halo effect. This is a malignancy. Now, you can argue what this is. This, in fact, was a GIST tumor, not a great surprise, but it could have been an adenocarcinoma, and based on bulkiness, could have been a lymphoma. The least likely diagnosis is Crohn's disease, and as I mentioned, this was a GIST tumor. 40-year-old female with hepatitis C, what's the diagnosis? You see a 4-centimeter vascular liver lesion that is hypodense on venous phase, and then hepatitis C always makes me think of hepatoma. Hepatic adenoma is a possibility, but usually it becomes closer to isodense, but it's possible. FNH are always isodense, and hemangioma have peripheral puddling. This is not a hemangioma. So really you're stuck between hepatic adenoma and hepatoma. When you're thinking about that, hepatic adenomas can become hepatomas, and also once you have hepatitis C, you better be thinking hepatoma, and this in fact was a hepatoma. Now, I came across this case, and I really liked it, so I made it a quiz case. At first, it looked like there's a mass in the pancreatic head pushing under duodenum, but there's no dilated ducts. So you still would consider pancreatic cancer. Lymphoma, I would consider maybe bulky adenopathy near the pancreas. The one thing, this is not as a cystic lesion like a serous cyst adenoma. Now we know serous cyst adenomas can be solid, they enhance, but this is not enhancing. This is solid, it's pushing on the duodenum. In fact, this was metastatic melanoma to the duodenum. Just a terrific case. Remember, melanoma is a great mimicker. Serous cyst adenoma is a great mimicker. Sometimes it's vascular, sometimes it's more cystic or less cystic, but I would not consider it in this case, and so it's the least likely diagnosis. Just a really nice case. The best diagnosis in this case: anterior mediastinal mass, eccentric, calcifications and fat. This is classic for a teratoma. There's nothing else to think about. If it was solid and total, lymphoma would be a consideration. Carcinoid, we're not thinking about that. Thymomas are anterior mediastinal masses, but they don't have fat. They can have calcifications, particularly if they've been treated. So this was a beautiful example of a teratoma. This is a great case. There's a mass, left lobe of liver on MIP with neovascularity. You see it washes out quickly on the venous phase, but it's still there. That's not the vascularity of hemangioma or FNH. At times, hepatic adenomas have a lot of weird shapes, but they do tend to become isodense or nearly isodense. This is a great case of hepatoma, hepatitis C, neovascularity, irregular liver, and a low-density mass on venous phase imaging. So I showed you 10 great cases. I hope you got them right, and I hope you learned something. And with that, I hope to see you next month. Have a great time, and see you later. Bye.
If you liked what you heard here today, please make sure to hit that subscribe button and visit our website ctassist.com for lectures, quizzes, pearls, and more. Also, be sure to check out our apps that are available for free on the Apple Store. All links are in the description box below.